Hi everyone, this is one of our classes on euthanasia and assisted suicide. We will talk about legal and ethical considerations. This PowerPoint was found online and I modified it a little bit. It is well done and I would not put it together any better. I added some information to it, so enjoy it the way it is. We will be talking about what is euthanasia, what is assisted suicide, what is DNR, do not resuscitate orders. Uh, we will cover the topic of the right to die and also mention some disability movements such as Not Dead Yet that are against euthanasia and assisted suicide. How can we define euthanasia? Euthanasia comes from a Greek word that means happy death. It is synonymous with mercy killing, which is, for example, explained as ending a life of suffering. It is usually done by a third party, for example, a doctor or a family member who performs an act that results in death. On the other hand, assisted suicide is when a third party provides the method and means for someone else to die, but the individual, usually himself or herself, performs final act that results in death. Do not resuscitate orders are written directives to healthcare providers from doctors and adults, or a parent or guardian of a child, to prohibit emergency intervention to restore function when cardiac or respiratory failure occurs. These DNR orders are controlled by state law that establishes standards including limitations on who can issue and implement an order. Do not resuscitate orders are, however, sometimes given to patients who are terminally ill when they are admitted to a hospital, and sometimes they may not even be aware of what they are signing. There were cases that occurred when they signed that and then they were not resuscitated when they needed to be. What can we label as euthanasia? It can be when a doctor injects a patient with an overdose of narcotic drugs used to alleviate pain but intending to cause death. It can be when husband suffocates his terminally ill wife at her request. Or it can be when mother unplugs respirators to her two sons with progressive neurological disease so they will die because they no longer have conscious awareness of their environment. And here's some questions that we should consider. Has a killing occurred in these examples? Has a murder occurred? Are these acts crimes? To answer that, not in the Netherlands and in Belgium or in Luxembourg when euthanasia has been legalized. Now, how can we define assisted suicide? It can be, for example, when a person swallows overdose of drugs that the doctor provides to the individual for the specific purpose of causing death. It can be when a patient performs some action that causes a lethal dose of drug to flow through veins. Or it can be when a wife prepares a drink with sufficient drug to kill her terminally ill husband because he wishes to die but can no longer independently take steps to do that. Again, we should consider the same question. Has a killing occurred? Are these suicides? Are these crimes? Suicide is not a temporary crime, although it may be in some religious laws. And in some states, like Oregon and California, and Germany, Switzerland, Netherlands, Belgium, and Luxembourg, assisted suicide is legal. When we discuss euthanasia or assisted suicide, we quite don't know how many cases occur, what is the incidence of euthanasia or assisted suicide, because some doctors usually don't report that, and there has been some surveys done, but often we don't know the whole truth. Oregon reports that 85 prescriptions were written for lethal doses and 46 patients died by taking the medication in 2007. But some surveys of individual doctors show that about half of them believe that physician-assisted suicide is ethically justifiable in certain cases. And they also say that about 1 in 5 doctors will receive a request for assisted suicide sometime in their career, and between 5 to 20% of those requests are honored. State States have been making some efforts to pass death with dignity laws. 26 states in the United States have attempted to pass such laws and 25 failed. However, there are some states that passed that, and I've included a map. If you look at the dark blue color, that's California, Oregon, and Washington, and Vermont on the East Coast. Euthanasia and assisted suicide are legal. The light blue colors are states when euthanasia is legal under some court rulings, and the browner state have been also have shown or have had some cases in the past when courts decided in favor of the patient who wanted to perform euthanasia or assisted suicide. Um, there is some organizations that are against physician-assisted suicide and euthanasia. An example of that is Coalition Against Physician-Assisted Suicide. Also, there are many Catholic groups and other religious organizations, some doctors, but mostly also disability advocates. A patient needs to give an informed consent and show that they are competent to sign that they want assisted suicide or euthanasia. Informed consent is a common law doctrine. It is a consent for medical procedures that the person must be competent, voluntary, and it also has to be informed about the act. Voluntary means that there should not be any extreme pressure. The patient should not be medicated, intoxicated, or threatened by doctors or others. A consent of a family or anyone else is not required for competent adults. Competency is another concept that when the law assumes that every adult is competent, challenging competency places burden on challenger to prove incompetency. Incompetency is ultimately a legal determination. Adults who have adequate capacity or competency to make decisions about their health care entitled to do so based on personal interpretation of interest. And adults who demonstrate adequate capacity to comprehend facts and concepts and express choices can provide informed consent or refusal. Now, this is problematic when it comes to people with mental disabilities or people who are, terminally ill and dying, and they might not be viewed as competent to give such consent. So, what about people with disabilities? If there is a court-appointed guardian, and often people with developmental and mental disabilities have guardians who have the authority to make healthcare decisions. The guardian, usually the individual who must provide the informed consent and or request the advance directive. A doctor or a family that claiming that or talking about quality of life that is not sufficient for a person is not a legally authorized component of the decision. Courts are not allowed or do not allow non-treatment decisions to be made solely on the basis of incompetent persons' future medical cost of physical disabilities. So the cost of life or medical procedures of one's disability or maintaining someone's life in a hospital is not considered or is not an argument that would be helpful in deciding whether to do assisted suicide or not. If, for sake of the argument, we say that there is, then what should the parameters be, if any? The parameters should be that assisted suicide and euthanasia should be kept as crimes, but people should not be prosecuted for doing that. Assisted suicide and euthanasia should be kept crimes, but only those actors that we find offensive should be prosecuted. We should trust the doctors to do the right thing, but nobody else. We could legally sanction euthanasia and assisted suicide under very narrow circumstances, but people with newly acquired disability must have a slow right to choose that. This is a spectrum of where you can see how problematic the whole issue is, and there's a spectrum, and it all is based on individual cases, whether euthanasia and assisted suicide could or should be considered crimes and should or could be prosecuted at all, and whether people should and could have the right to die and decide their lives. Um, Not Dead Yet is a movement formed in 1996 in response to Kevorkian case when he helped two women with non-terminal disabilities die. Um, Not Dead Yet is an advocacy movement made mostly by people with disabilities. There is a link to an article by Harriet Johnson who comes from the Not Dead Yet movement. She has several disabilities, but she talks about how her life is worth living. Um, the Americans with Disabilities uh, Act also prevents euthanasia and assisted suicide and talks about the quality of life. Here are some quotes by the advocate. One says that Americans with disabilities don't want your pity or your lethal mercy. We want freedom, we want life. Another quote uh, by a person with disabilities says that the targets of legalized assisted suicide and euthanasia have come together to oppose the political movement and would sacrifice our lives for their idea of dignity and the greater good and the profits of the healthcare industry. So, finally, here's some perspectives that you need to keep in mind. Euthanasia and assisted suicide have become medical treatments and not crimes. Doctors can decide that these treatments are appropriate for those who are incompetent. No consensus has been made on what person's condition should be prior to granting permission or forgiveness. Um, the, it depends state to state. For example, in Oregon, terminal means a condition which will, within reasonable medical judgment, produce death within 6 months. In Netherlands, this the law says that unbearable suffering of either a physical or mental nature is sufficient factor. And in other states, it can be quite different. So again, it needs to be decided on individual cases, and it needs to be decided on state by state cases. I want you to consider this. Disability almost always is more a matter of social attitudes than individual impairment. Fears of disability sometimes slide from fear to disgust, and from disgust to hatred. The public's fear of ever living like that can quickly slide into the argument that someone should not live. We need to make a sharp distinction between, on the one hand, fearing for oneself ever living such a life, and on the other hand, ordering and supporting the termination of a life that arouses fear. Euthanasia or assisted suicide um, should not be dependent on the healthcare cost. In a law case, Washington versus Glucksburg, the court said that the least costly treatment for any illness is lethal medication, but we should not take cost into consideration. Here we get into a slippery slope about is it too expensive to maintain someone's lives, and should we ever ask the question? Euthanasia and assisted suicide are reactions to fear that turns to hatred. Finally, I would like to recommend a few movies if you want to deepen your perspective on assisted suicide and euthanasia. For example, Whose Life Is It Anyway? The Sea Inside, which is by a person who has been fighting for 30 years to die. Another movie with Al Pacino, You Don't Know Jack, on Dr. Jack Kevorkian, the doctor who helped many people to die. And most recently, $1 Million Baby. So enjoy those movies if you like the topic, and keep in mind that we should never ever say that someone's life is not worth living.